like to welcome everyone to this special segment of our Mikey Live program. And as you can see, today we have a doctor with us, and we'll explain who she is in a moment. There's a lot of talk that's been going around now, I guess as much from the announcement that we've heard from the medical team yesterday, from the CMO, Dr. Sean Charles, and of course, as well, the Minister for Health. There's a lot of questions that we have to be asked, and we think we've found the perfect person to assist us with that. Now, standing by, we have Dr. Purvi Parikh, who is a medical doctor. She actually graduated right here in Grenada from the St. George's University in 2008. And she's now an allergist, an immunologist, and a vaccine researcher actually at the New York University Langone Health. Now, she's currently working on multiple COVID vaccine trials and was involved with the initial trials with Pfizer, AstraZeneca, and Sanofi. Now, she's working on a booster study with Pfizer, given the new variants such as the Delta variant, and is studying the vaccine in new moms and their babies, mommy vax. So we'll say hello and welcome to Dr. Purvi. Hi.
Hi, how are you? Thank you for having me.
Okay, I'm good as well. I have to say, how much of a pleasure it is for us to be speaking with you tonight about the COVID-19, about the vaccine, about the variant, the Delta. So it's a pleasure.
Thank you. I'm glad it's an important topic.
Yes, it is. It is indeed an important topic. So let's get right into it. We are hearing now early reports of a possible outbreak of the Delta variant here in Grenada. What makes this such a serious issue? What makes it such a serious threat?
Yeah, it is a very serious issue because the Delta variant is much more contagious than the original strains of the virus, meaning that it's 2 to 4 times more contagious. So with the original virus, you only have to be in close contact with someone for 15 minutes to put yourself at risk of catching it. Now with the Delta variant, that can occur in only 5 minutes. So it's very short contact with people. And not only is it more contagious, but it's more virulent. So what that means is it creates almost 1,000 times the amount of virus in your airways that we used to see with the original forms of the virus. So this can be very dangerous and very hard for your immune system to fight off. And it can spread from person to person very, very quickly.
You mentioned you probably being in somebody's space who is infected for about 5 minutes so that you can contract the virus. But do you need to be in that space for that long in order to be able to contract the virus?
No, actually, you can even contract it in sooner than 5 minutes, especially if it's an indoor space, if people are unmasked. And again, even if you're not super close to the person or someone you may share workspace with or household with, you still are at very high risk. So that's why it's very important to protect yourself by getting vaccinated.
And I want us to make a step back just a bit. How can you contract the virus? Do you have to actually touch someone, or are they spread by droplets? How does that work?
Yeah, it's a great question. It's a respiratory virus, so it is spread by droplets. So, if someone coughs or sneezes and you inhale those droplets, then you can get sick. Also, the virus is airborne, meaning those droplets can linger in the air for some time, even a few minutes or even 10 minutes after that person has passed through that area. But touch is also a frequent way. So that's why we keep telling everyone, keep washing your hands. Don't touch your eyes or nose or your mouth, because if your hand comes in contact with the virus and you touch your mouth or your nose or your eye, you can also contract it that way too.
We're hearing that these viruses, particularly COVID, as we're speaking about now, they are mutating. Why does the Delta variant present a different challenge than other variants, and how do they mutate?
Right. So viruses are meant to mutate. That's how they continue to survive. But the problem is they can mutate much faster if the host or person who they're infected is able to pass it on more easily. And so a lot of these variants are arising in actually unvaccinated folks because people who are vaccinated or who got vaccinated early aren't really spreading the virus from person to person, and they're getting sick less too. So there's less chances of a virus to mutate between two vaccinated individuals. However, if you get sick with the virus and then you pass it on to someone else, this gives the chance for the virus to mutate. And the reason why these variants are so dangerous is because it's the way it's mutating, it makes the virus more contagious, and it can make it more deadly too and more dangerous, because now we're seeing so much higher counts of the virus and affecting even children now. So there's a lot of concerns with the newer variants.
Yeah, and I wanted to come with that now to that part of it. Now, how does the Delta variant affect the vaccinated versus the unvaccinated?
Yeah, it's actually night and day how it affects the vaccinated versus the unvaccinated. And the reason being that currently, I'll speak to the US because that's where I am now, over 99.5% of people dying are all unvaccinated. So majority of people dying unvaccinated, and over 90% who are in the hospitals, who are very sick in the intensive care unit, on the breathing machines, they're also all unvaccinated. So yes, vaccinated people are getting sick, but they're getting much milder infections. They're able to recover at home and they're surviving. You know, the vaccine is saving their lives and keeping them out of the hospital.
All right. Now, are the symptoms different in the Delta variant versus other variants of the virus itself?
Yeah, some people are noting that there are more symptoms that are harder to distinguish between the Delta variant and, let's say, a common cold or allergies. So we are seeing some more sneezing, especially if you're vaccinated. The symptoms might be very, very mild, so you may not even realize that you have it and you're passing it on to someone. That's where it can be troublesome. But again, more common symptoms are, fevers. That means a temperature at 100 or higher, chills, loss of smell, taste. You can also have stomach upset or diarrhea too. And you just feel extremely fatigued and with body aches as well.
You mentioned vaccines a lot because I think that what we are hearing is that vaccines are the key to slowing the spread of the COVID-19, whichever variant we are talking about. Now, some people in Grenada think that the vaccines are experimental and are not medically approved. Can you address this concern for us?
Yeah, that's a concern even in the US. And I can assure you that they are not experimental, and I'll explain why. The AstraZeneca vaccine, which I know is widely available in Grenada, that technology, which is called the adenovirus vector, means that how the vaccine delivers the information to your immune system is that another inactive virus carries it in and delivers it to your immune system. That technology has been around for over 80 years. We actually even have a vaccine, the Ebola vaccine, that's already widely being used, that uses that same technology as AstraZeneca. So it's not really experimental. And even before this COVID vaccine was approved, it went through very rigorous studies. So 30,000, 40,000 people were studied, and they continue to be studied even to this day. So again, it's not very experimental. And I just want to stress that getting the virus is far more experimental because, one, it makes you sicker. It can kill you. It can make you end up in the hospital. And the long-term effects of the virus, we are still very much unknown, whereas we know we have 80 years of experience with this type of vaccine. Then the other vaccines, the mRNA vaccines, Pfizer is an example, Moderna is an example, they also are not experimental because we've been using this technology as well for 30 years before even COVID started. And even those trials were very thoroughly done. I was involved in both AstraZeneca as well as the Pfizer studies, and I can assure you no safety checks were skipped, and they were very thoroughly tested in all groups, and they continue to be tested. And the good news is Pfizer, that one of the mRNA vaccines, is set to get full FDA approval in the upcoming weeks. So it no longer will be an emergency use approval. Often that is unsettling to people. But again, I can assure you it's not experimental, and we should all be far more afraid of the virus and the variants than the actual vaccine itself.
And while we are speaking about vaccines, I know that there are some skepticisms whether it is about the Pfizer or the AstraZeneca. We've had the AstraZeneca here, and some people expressed that they would prefer a different vaccine. Now that we have gotten the Pfizer, I believe it was today, are there vaccines that are better than others?
Yeah, I get asked that question almost daily. So the short answer is no, or it's almost impossible to say because until we can study all the vaccines together in the same clinical trial where they're all compared side by side, we can't say that one is better than the other. And the reason being is that, Pfizer was approved for emergency use, and the other mRNA, Moderna, was approved for emergency use even before a lot of these variants were in circulation. And then AstraZeneca came out after that. So we don't know. They may actually be very similar in efficacy, and we don't know because they weren't studied at the exact same moment in time. They weren't studied with the variants. But that being said, AstraZeneca is still doing very well with the variants, meaning it's still saving people's lives. So people who are vaccinated are not, even if they get sick, they're not passing away. And it's also keeping people out of the hospital. So to date, they're both equally good vaccines for what we really want to protect, which is severe disease and death.
All right. What would your response be for persons who say, well, there might be people dying from taking those vaccines, so the risk is the same whether you take the vaccine or you don't?
Right. So, I know that there's been a lot on the news of rare blood clots with the AstraZeneca vaccine in particular, the Johnson and Johnson vaccine. And just to clarify any misinformation, actually, it's extremely rare. So it was 1 in a million was a statistic. So that means you're actually more likely to be hit by lightning than any adverse reaction from the vaccine. And the same goes for allergic reactions. Even though, the media put a lot of attention on this, it is the same amount of incidence. So you actually are much more likely, if you get sick with COVID, to pass away. We have over 4 to 5 million deaths globally. Not only that, let's say you don't die from COVID, you are not back to normal. This is not like a cold. This is not like a flu. I have patients that 18, 19 months later are still suffering because they had strokes, completely healthy before. They had blood clots in their lung and their heart. They're now on dialysis because they have kidney failure or they needed new lungs as a result. So they can't work. They're having memory issues. They're saying 1 in 3 COVID survivors has some type of brain or neurological issue. That's very high. That's much more higher than a 1 in a million chance of an adverse reaction to a vaccine. So your best bet is still, get the vaccine, because if you get the virus, bad things happening to you, including death, is much, much higher.
Okay, thanks for that explanation. Now, should pregnant or nursing mothers in Grenada be concerned about taking any of the vaccines?
So no, they should not be concerned, because similarly to, all of the other groups, we studied pregnancy and nursing as well, and now we're studying them even more thoroughly. Right now, actually, I'm involved in a trial with the National Institute of Health where we are looking at pregnant women who are vaccinated, and we're going to continue to follow them and their children even after they give birth. But what we know so far from the 30,000 or so, actually close to 40,000 now pregnant women in the US who are vaccinated, is that we found that it was overwhelmingly safe. So there was no increased risk of preterm labor, having an abnormally small child, complications to the mother, such as eclampsia, preeclampsia, where your blood pressure can go up. There was no increased risk in the group that got the vaccines versus those that didn't get the vaccines. And we found an added bonus was that their babies were born with immunity too. So it was a win-win situation. You're actually protecting 2 lives, for the cost of one vaccine. But the other side of it is, if you're unvaccinated and pregnant and you get sick, it can be deadly. So currently, most of the young women that we're seeing in the hospitals in the US, and sadly even passing away, many of them are pregnant women. Many are unvaccinated. And all of us healthcare workers have heard horrible stories where, we were able to save the mom, but not the baby, or able to save the baby, but not the mom. And we never want to be put in that situation. So please protect, your life as well as your baby's life. The second problem too, which we're seeing for the first time with the Delta variant, is that pregnant moms who are not vaccinated and have COVID, when they give birth to their babies are being born with COVID. So we're seeing babies who are only a few days old in the neonatal ICU fighting off a COVID infection. So that is not the way you would want your child to start their life. So please, protect yourself. It is overwhelmingly safe in both pregnant and nursing women. And nursing women too pass on the benefits. They pass on that immunity to their child as well through the breast milk.
Oh, interesting. But what about people with chronic disease, such as diabetes, blood clots, or high blood pressure, and so on? Should they worry about taking a vaccine?
No, they should not worry, but about taking the vaccine, but they should be worried about the real virus. And the reason being is people with diabetes, high blood pressure, heart disease, they are at much higher risk of dying from the COVID-19 disease. They're also at much higher risk of ending up in the hospitals and the intensive care unit. And ironically, you're much more likely to get a blood clot from the real virus than from the vaccine itself. So you're ironically protecting yourself from blood clots by actually getting vaccinated, because that prevents this virus, which we know wreaks havoc on all of your body, and it can cause damage to all of your organs, and it can cause clotting too.
Wow. Now, if someone is not sure about taking a vaccine yet, for whatever reason, they are still a bit hesitant, can they be protected by herd immunity or regular PCR testing?
So, yeah, that's a great question. So, ideally, yes, if enough people are vaccinated and the infection rates are so low, it can protect you. But the problem is, we don't have enough people vaccinated. So, even in the US, where we have close to 50% of our population fully vaccinated, that's nowhere near herd immunity. For herd immunity, you need close to 80%, especially as new variants are popping up. And then the other issue is with the frequent testing is, one, not only are you not protected, but the PCR testing is not perfect. We have a third of tests are actually what we call false negatives. So it can falsely tell you that you're not sick in 30% of cases when you actually are. So again, taking that approach of relying on everyone else to get the vaccine and just testing yourself is not a very safe way to go, because statistically, you're still really setting yourself up for risk.
COVID-19 is a serious challenge for a lot of people. I know that you've been working, but how are infectious disease specialists such as yourself working to really combat the COVID-19? What's involved here?
Right. So, the biggest thing is vaccines. There's no infectious disease in all of history, like measles, mumps, polio, that has ever reached herd immunity without a vaccine. So, this is a brand new virus that our immune systems do not know how to deal with at all. That's why it's causing so many deaths. It causes blood clots in 30% of people who are admitted to the hospital. It causes all these long-term problems because our immune systems are not used to fighting it off. So the vaccines are the most important way to get out of this pandemic. I know everybody's sick of it. So that was the main thing, is to get a vaccine, and a vaccine that continues to work and continues to keep people safe from severe disease and death. And then secondly, a lot of new research is going into people who are ill, who've already gotten sick. So there's certain treatments like monoclonal antibodies that we can now give early on in an infection that will help reduce, the likelihood of you ending up in the hospital or ending up, dead from COVID-19. But the problem is these medications are highly, highly costly, and they don't always work in everybody. So that's why prevention is always key. And that's why most of medicine, including infectious disease and immunology, focuses on prevention. Because if we can avoid you getting sick, then we don't have to figure out how to get you better, and even if we have great ways to get you better, excellent medical care, it doesn't always work in everybody because everyone's immune system is different. So the best way is to not get you sick. But that being said, a lot of research is going into other therapeutics to combat COVID-19 if you do get sick. So the monoclonal antibodies is one. We have a lot of good data coming out with use of steroids in certain patients. So it really depends. And now a lot of research is looking forward at the long-term effects of COVID-19. So over 75% of people, even 6 months to a year later, still have some residual symptom from their infection. And many people have what we call long haul COVID, meaning they are suffering with so many issues that they never had before: brain fog, heart problems, lung problems. So a lot of research is studying these folks because this is going to be millions and millions of people, those who recovered from COVID-19 but are still suffering a year later, unable to work, unable to go to school, many of whom are living very, very debilitated.
Why are you so passionate about sharing this insight with the Grenadian community?
Well, for many reasons, Grenada holds a very soft spot in my heart. I lived there for 2 years. I'm a medical doctor because of Grenada, so I owe a lot to the country, and I feel I feel a part of it. I feel the Grenadian community is a community that I belong to, even though I no longer live there. So I feel very protective of the Grenadian community. And so I would like them to be able to stay safe and avoid a large spread outbreak on the island because, I've lived there and I know that if there is widespread outbreak, it would be very hard on an isolated island for the health systems to cope. Even in the US, we are already having collapse of our healthcare systems in certain states, and there's no coincidence. They're all states where the vaccination rates are low. So Texas, Arkansas, Florida, Arizona, we're seeing over 90% of their intensive care units full. They're having to turn away patients. So I feel very protective towards Grenada for many reasons because I have a personal connection, but I would hate to see, people get sick, people die unnecessarily because right now it's all preventable. We have a vaccine, we have a way to prevent death and devastation. So, that's for all of those reasons. I was on the island when Hurricane Ivan hit in 2008. And that was nowhere, that was grand destruction, and that was heartbreaking for me. So I would never want to see Grenadians suffer in that capacity or even worse ever again.
Okay, wow, wow. Now, one more thing I have to ask of you. Let's take off the doctor hat for a while. And someone comes to you and says to you, let's imagine as well that they didn't have the opportunity to listen to this program. They have a minute or two to get that answer from you, heart to heart. Why should I be vaccinated? What's your answer to that question?
Yeah, that's a great question. So you should be vaccinated, one, to save your life, to keep yourself out of the hospital, but you're also then, by vaccinating yourself, protecting your loved ones, your mother, your father, your brother, your sister, your children, because vaccines not only protect you, but they protect everybody around you. The second thing is you should be far more afraid of the virus and the variants than the vaccine. Seeing millions of deaths globally, and now seeing billions likely of people who will continue to suffer for we don't know for how long. I urge people to get vaccinated and prevent this from occurring. Because even if you survive COVID-19, you're nowhere near normal, even if you were perfectly healthy before.
Great answer. Thank you very much, Dr. Purvi Parikh. And of course, we really appreciate taking your time to come to speak to us about this very pertinent issue.
Thank you. And one last thing I would add, another reason I would say get the vaccine is like I myself have gotten it and all of my loved ones have gotten it. So I would never advocate for something or take something if I didn't feel that it was very safe and effective. So that's the last thing that I would add. It's very safe, it's very effective, and don't view it as something experimental.
All right, great. Well, thanks again, and it's a pleasure. I mean, we're going to see how things go, and if there's need for us to call you back again, because I think you were really good in explaining, the questions that you were asking and the manner in which you explained it to us. I think it will help a lot of Grenadians to make their mind up as it relates to vaccination and how they go about, just observing the existence of the COVID-19.
Yeah, absolutely. I'm happy to come back anytime.
Okay, great. Thank you very much.
Thank you.